Now I'll discuss about some CT scans of acute brain injuries. This elderly patient who presented with acute confusion has a large area of low density in the right frontal lobe seen on the current CT. Review of a previous CT revealed that the abnormality in the brain was not new but related to an infarct which occurred 5 months earlier. The current CT appearance were not the cause of the acute confusion. Now, brain versus bone CT windows. The rollover images show the bone window images at the same level as the brain windows. The brain window images provide limited detail of bone structure. The bone window images provide no useful detail of brain structures. The image on the left shows the original brain window setting in the context of suspected intracranial hemorrhage. It is often helpful to adjust the window setting manually. The image on the right, which uses a modified window setting, shows the large subdural hematoma more clearly. Axial images with corresponding coronal and sagittal plane images shown using brain windows. This scan shows an intraventricular shunt used for treatment of hydrocephalus. The ventricles are very large. The image on the left shows the result of movement during scanning, and the degraded image was repeated and no pathology was shown. Movement artifact and the repeat scan. Beam hardening and scatter artifacts CT brain, white strips are seen along the lines between the thickest part of the skull. The brainstem is a common place to see beam hardening artifacts. Streaks of low density are visible in the pons passing between the thick and dense petrous bones. The density of bones of the skull base often limits CT image qualities of brainstem structure. If there is specific clinical concern regarding the possibility of brainstem pathology, then MRI should be considered. Single slice section, the single image shows an isolated focus of high density which could be mistaken for blood. The image shown below this slice, rollover image, shows the area of high density is part of the petrous bone. This CT shows a large irregular area of low density which is distorting surrounding structure mass effect. The rollover image demonstrates ring enhancement. Contrast enhancement indicates that the edge of the lesion has a high vascular supply. The central part does not enhance as it is necrotic tissue with no vascular supply. In this case, the lesion is a glioma, primary malignant brain tumor. Now, scalp hematoma and skull fracture. Scalp hematoma, the bone window images shows a clearly defined skull fracture. The brain window images shows a small intracranial collection of blood in the subarachnoid space. A small scalp hematoma is seen on both the bone and brain window images. Skull fracture versus a suture. Only one of these is a fracture, but which one? The suture is in typical position of the lambda suture and it appears jagged and corrugated. The fracture passes across both inner and outer table of the skull in a straight line. Skull fracture versus suture. At the interface of a suture, the surface of each bone is covered by a layer of cortical bone which is continuous with inner and outer tables of the skull. At the site of a skull fracture, the bones are not corrugated. Note how straight the fracture is compared to the jagged suture. Deep skull fracture, severe trauma to the skull may result in depression of the skull bones. The bone window images provide good details of the depressed skull fracture. The brain window shows the accompanying intracranial hematoma. Basal skull fracture, fractures of the basal skulls can be difficult to identify. In this setting of acute head injury, a fluid level in the sphenoid sinus can be helpful sign of a basal skull fracture. Brain volume, young versus old, size of the CSS spaces varies with age. You can see here 10-year-old and 90-year-old CT scan images, small sulci and small ventricles in a 10-year-old patient, and in case of the 90-year-old, large sulci and large ventricles can be seen here. Normal versus abnormal brain volume, assessment of the size of the sulci is often easiest near the vertex of the brain. Both these patients are in their 60s. The image on the right shows loss of volume with corresponding enlargement of the sulci in an alcoholic individual. Now, hydrocephalus, the ventricles are massively enlarged. The periventricular white matter appears of low density due to transependymal edema. The sulci are not enlarged. Alzheimer's disease, the temporal lobes are much reduced in volume, particularly on their medial side. Enlargement of the temporal horns of the lateral ventricles, as shown in this image, it is a specific sign of volume loss of the temporal lobes. Hypoxic brain injury with cerebral edema, the image shows striking loss of differentiation between grey and white matter structures due to generalized cerebral edema. The ventricles and sulci are very small for a patient of this age, indicating generalized brain swelling. The 75-year-old patient had a prolonged period of hypoxia during cardiopulmonary resuscitation. Chronic small vessel disease, patchy low density of the cerebral white matter is a sign of chronic small vessel disease. Old lacunar infarcts appear as small areas of low density on CT scan. These lacunar infarcts are in the typical distribution of the middle cerebral artery perforator branch territory. These are the old lacunar infarcts. Old territorial infarct, the current CT shows a well-demarcated rectangular area of low density replacing both grey and white matter. This is a typical appearance of an old infarct, in this case involving the left middle cerebral artery territory. The previous CT performed at the time of the acute event 3 years earlier is shown for comparison. There you can see here the current CT and the previous CT. Also note the generalized loss of brain volume over time, enlargement of the sulci. Acute territorial infarct, an area of low density seen in grey and white matter of the right frontal lobe. The patient presented with an acute left hemiparesis. Onset is 4 hours earlier. Now, hyperdense dense MCA sign, dense thromboembolic material is seen filling the right middle cerebral artery. So you can see here dense right middle cerebral artery and normal left middle cerebral artery and normal basilar artery. Insular ribbon sign, the insula normally has a thin layer of a cortex. In this patients, there is a certain loss of clarity of this layer of cortex on the right. So normal insular ribbon and the abnormal side is shown here. Extradural hematoma, a lens-shaped collection has formed following trauma to the left side of the head. Note the collection of blood is limited at the points of the sutures. This is the typical appearance of an extradural hematoma. There is no accompanying fissure in this case. Don't forget to check the bone windows. So you can here localize coronal suture and the lambda suture. Subdural hematoma, a large crescent-shaped collection is seen over the left side of the brain. The collection is of high density material due to the presence of clotted blood. There is no blood extending into the sulci. The sulci on the side of the hematoma are partially effaced, during indicating mass effect. Subarachnoid hemorrhage, dense blood is seen filling the basal cistern, fissures, and the fourth ventricle. Subarachnoid hemorrhage, ventricular blood. Subarachnoid hemorrhage may result in blood collecting in the ventricles. Occasionally, a layer of blood in the ventricles is only sign. Subarachnoid hemorrhage, sulcal blood. Blood within the subarachnoid space is seen in a sulcus of the left cerebral hemisphere. This may be a subtle finding only seen on a few slices. Spontaneous ICH, a large area of high density material is surrounded by low density edema, that is, blood is surrounded by low density edema. This patient had a previous history of intractable hypertension and presented with sudden onset of right sided weakness. Traumatic ICH, this intracerebral hemorrhage has the same characteristics as the image of spontaneous hemorrhage shown above. The bone window image shows an adjacent skull fracture in this patient following head injury. ICH with subarachnoid extension, this image shows a small intracerebral hemorrhage with a surrounding edema. High density material within the sulci indicates leaking of blood into the subarachnoid spaces. Note that the other image on this page also show extension of bleeding into the subarachnoid space. Glioma CT brain pre-contrast image. This patient presented with clinical features similar to an acute stroke and a recent history of worsening postural headache. A large irregular separate area of low density is seen on the right hemisphere. Mass effect is present, effacement of the sulci, lateral ventricles and basal cisterns. Glioma CT brain post-contrast image, same patient as image above. A patient post-contrast CT of the brain was performed. There is ring enhancement of an irregular separate mass. Central low density is due to necrosis, surrounding low density is due to edema. Cerebral abscesses have similar enhancement characteristics and should be considered as a differential diagnosis of a ring-enhancing lesion. Cerebral metastases. Multiple lesions were seen on both sides of the brain in this patient who had a known diagnosis of lung cancer. This post-contrast image shows ring enhancement of the lesions. Meningioma CT brain shows a large mass enhances brightly following administration of intravenous contrast. A large area of edema is seen adjacent to the mass. The mass makes broad contact with the meninges. There is a dural tail tapering on the mass to a point on the meningeal surface. Now, sulcal effacement, a space-occupying lesion below the level of the CT slice, is causing mass effect with effacement of the sulci over the whole left cerebral hemisphere, compared with the contralateral side, which shows normal sulci. Ventricular effacement. This image shows a small cerebral bleed with surrounding edema. The combination of the blood and edema is causing mass effect, effacement of the adjacent sulci, and partial effacement of the adjacent lateral ventricle. The left hemisphere structures appear normal. Effaced ventricles, edema, and blood is shown here. Shift of midline structure, post-contrast CT brain. The image shows an intracerebral tumor, which along with surrounding edema is causing mass effect. The right hemisphere sulci are effaced. The right lateral ventricle is totally effaced. Structures normally found in the midline are deviated to the contralateral side. A large acute left subdural hematoma is causing severe mass effect. The left hemisphere sulci and lateral ventricle are effaced. The midline structures are shifted to the right. The contralateral sulci are effaced. The right lateral ventricle is distorted, effaced anterior horn and focal hydrocephalus of the posterior horn. Effacement of the basal cistern. The large mass in the right cerebral hemisphere causes mass effect. The adjacent sulci and lateral ventricles are effaced. The basal cisterns are also effaced.